patient is a 22-year-old who was involved in a snowboarding accident. She is currently experiencing neck pain that is classified as a coordination impairment, and she is currently in the subacute phase of healing. Typically, patients in this classification show signs and symptoms of headaches, dizziness, nausea, difficulty concentrating, and is typically linked to trauma or whiplash. The patient did experience some whiplash during the snowboarding accident, and which led her to have headaches. And she is also currently experiencing sharp pain with cervical rotation and some hypomobility in cervical flexion and shoulder abduction ranges of motion. Common interventions for this subacute phase of healing include cervical isometrics, cervical ranges of motion, cervical stretching, upper extremity scapulothoracic strengthening and endurance, and some deep neck flexor stabilization coordination exercises. Neck Disability Index score informs us on how much the patient's neck pain will affect their day-to-day life. The patient's neck disability index score was 46%, which is a moderate disability. She experiences pain, and because of that pain, she also experiences difficulty sleeping and difficulty grooming, specifically shampooing her hair. The deep neck flexor test helps us assess the cervical motor control. When positive, impaired activation of deep neck flexor causes headaches. Increased activation of superficial neck muscles causes motor dysfunction. Encourage the patient to remain active. We want to keep those cervical muscles activated with some exercises such as cervical isometrics and deep neck flexor stabilization and coordination exercises. We can demonstrate some cervical isometrics with the patient to the patient today. We'll start off first with a cervical flexion isometric exercise. We start with placing your hand on your forehead, and without moving your hand, you're going to apply as much force as possible with your forehead onto your hand for 10 seconds. This will activate the muscles, your flexor muscles, specifically the deep flexors in your neck. So you will have a 10-second hold, and then 10-second rest, and then you will do this 10 times. And then you will do the same with some cervical rotation isometrics. Just place your hand on your temporal lobe, and again, place as much pressure as you can onto your hand without moving your hand. This will activate your cervical rotators in your neck. And we'll be doing a 10-second hold, 10-second rest, 10 repetitions. And the same on the other side. It will activate the cervical rotators